The following video is a mock demonstration of Parent-Child Interaction Therapy, or PCIT, a well-known empirically based practice intervention for families experiencing discipline and behavioral issues with children ages 2 through 7. In this hypothetical case, the child is an 8-year-old Korean-American boy named John. His parents, the Korean-born Mr. and Mrs. Kim, have had difficulties managing John's behavior for some time, and the situation has worsened since his older sister Lily's recent suicide attempt. In previous assessment sessions with the therapist, an unhealthy and abusive pattern has been uncovered between Mr. and Mrs. Kim and John. Though John is slightly outside the normal age range for PCIT, the family has agreed to try the technique suggested by the therapist. In the initial scene which follows, we shall demonstrate the first stage of PCIT called Child-Directed Interaction, or CDI. Take careful notes of the parent's use of the PRIDE skills. PRIDE stands for praise, reflect, imitate, describe, enjoyment.
Okay, Mr. Kim, I need you to come to the table a little bit closer to John, and please put your phone away. And once you get to the table, I need you to explain to John that this is special playtime and that he can play with any of the toys he wants.
All right, John, so this is your own special playtime, so you get to play with any of the toys that you want, okay?
And I need you to use all the CDI and PRIDE skills that you've been practicing while you follow along with John's play.
So, what are you doing?
Avoid questions, Mr. Kim.
You're just slamming Play-Doh. You should probably stop that.
Okay, I need you to avoid criticism as well.
Okay, keep the Play-Doh on the table.
Avoid commands, Mr. Kim.
Stop slamming the Play-Doh.
Mr. Kim, try and remember your PRIDE skills.
John, you have to listen to me. Damn it, John!
Okay, Mr. Kim, remember your PRIDE skills, and right now that John has moved away from the table, you're going to ignore the behavior, and I need you to take a deep breath and remember your PRIDE skills while ignoring John's behavior. And you need to start playing with the toys and explain the fun that you're having. Just try and take a few deep breaths. And you can start playing with the toys and describe the fun that you're having. I need you to use your words so that John can hear you, describing the fun that you're having playing with the toys, and eventually he'll come back to the table.
Alright, so I'm playing Army Men versus Lizards. All the lizard people came down to attack the humans. So I'm launching grenades at them, I'm blowing up lizards.
Good. Keep explaining the fun that you're having.
Man, this is so cool. It's just like out of a movie. The humans are beating the lizards, but more lizards are showing up. Where are they coming from?
Okay, once John starts playing with you appropriately, thank him for playing, but wait for him to act appropriately.
Thank you for coming back and playing with me, John.
Good job, Mr. Kim.
As the session continues, the therapist was able to guide Mr. Kim to appropriately interact with his son and increase positive and supportive communication. Pay close attention to Mr. Kim's implementation of the PRIDE skills and the positive reaction from his son, John.
Okay, so Mr. Kim, with this parent-directed interaction, if you want to explain to John how this session is going to go.
Alright, so John, this time we're going to play the games that I choose, okay? So for starters, let's set up the walls, okay?
Okay.
And then make some grenades on the side, maybe?
Okay.
And let's remember to keep all the toys on the table and to play gently and to put everything away when we're all done.
Okay.
Mr. Kim, that was a very good way of keeping the rules direct, specific, and stated in a polite way.
You're doing a good job setting up those shields. They look really strong.
Good praise, Mr. Kim.
The lizards on this side?
Yeah, let's put the lizards on this side, and then we'll set up the army people on that side.
Okay.
Once the parent and child have developed a stronger bond and the parent has mastered the CDI portion of the therapy, this next stage can begin. The second stage, called Parent-Directed Interaction, or PDI, involves teaching the parent how to effectively give the child instructions and utilize non-abusive forms of discipline when the child disobeys. Take special note of how the parent incorporates the pride skills into this stage as well. Therapy will emphasize commands that are direct, specific, positively stated, polite, given one at a time, given only when essential, and accompanied by a reason that either immediately precedes the command or accompanies the praise for compliance, learned during the CDI component.
You're doing a really good job setting up those lizards. You did it so fast. Can you help me finish up the rest of the humans?
Yeah.
Good praise, Mr. Kim.
We're getting closer.
Oh, so who's gonna attack first?
I think the humans.
The humans are gonna attack first?
Yeah.
Good reflection.
So,
Are they
so what are the
ready?
lizards gonna do?
They're gonna die.
Okay.
Gonna give them some grenades.
Oh, so the humans are getting some grenades? Oh no. Oh, John, can you pick up that piece of plate off the floor?
In a little bit. I want to keep playing.
I know, I want to keep playing too, but can we pick up the Play-Doh off the floor to make sure no one steps on it? So we don't want to get stuck in the carpet.
Yeah.
Good. That was a very good way of accompanying that by a reason.
Yeah, John, I don't want to... Remember last week when we had to go in timeout? I really don't want to... You'd have to go in timeout again.
Yeah.
Okay.
Oh, okay.
Very nice,
Thank
Mr.
you, John.
Kim.
I got it.
Good.
All
And
right,
make
thank
sure.
you, John.
Good. I like
You
the
did a great job
praise.
listening to me.
Very nice.
Thank you. Oh no, so all the snakes are dying.
At the conclusion of a typical 12-session PCIT therapy, the parent and child will have developed a much stronger bond and effective means to handle discipline if necessary. In effect, they will all live happily ever after.
Yeah, lizard
Okay.
graveyard.